Bismillah, alhamdulillah, wa salatu wa salam ala rasulillah. Today, presentation will focus on the role of quality professionals during COVID-19 pandemic. The trigger of this lecture was having a lot of feedback or questions from our colleagues working in quality teams in healthcare facilities, especially hospitals, asking about framework or metrics that will help them to get more involved and to take more role in addressing the pandemic. Some of them are very confused, and the others were just want to have a clear guidance. So we came up with this idea to just have some priorities from the main functions of quality team and during normal scenarios to maximize the effort and to address the issues in the epidemic or the pandemic. So our colleagues today during the presentation will be me, Dr. Mustafa Ghalwash, Dr. Islam Abu Yusuf, Dr. Mohammed Al-Fayoumi, Dr. Ahmed Al-Sheikh, Dr. Ahmed Al-Jamal, and Dr. Zakaria Abdul Hamid. All of them will have a part to participate and to give some ideas about their experience and practice, and also if there is any resources that will be of a help for you, we will share it during this presentation. The first part of this video, it is like rework because we failed yesterday to register it or to videotape it. So I just will go to the over the slides with some notes, and the second part will include the voice of my colleagues. So to go through the slides, actually this slide was just addressing the threat that all of us facing now. So it is like coronavirus. This figure was yesterday morning, so I believe it became almost 400 and more than 400 cases as confirmed cases, and the death rate became more than this figure. Actually, I have no other words to talk about this threat. It is we have a lot of countries that already started to have a lot of restrictions, which will affect everything in the healthcare system, including supplies, including some difficulties to resume their ordinary work. The influx itself of patients, if there is in some countries. So again, the need for supply chain or supplies or PPEs or staff or even beds are challenges that we need to address, or even to prepare ourselves to handle it in a proper way. We sent a questionnaire through the social media, and actually we got a lot of feedbacks. So Dr. Ahmed Al-Sheikh was yesterday was talking about the results, and actually what I remember from the result was there was a very frank questions. I don't in the feedback saying that I don't know what is my role as a quality professional in this epidemic. But the majority had concern about emergency preparedness and communication. So actually, this questionnaire helped us to just rephrase some of our slides. So it will be focusing on the hot issues for you. And this slide is just talking about the status of quality staff, that we don't want them to be an. Actually, we need them to facilitate or to work in, as a very effective team member with the current scenario. We know that some of our colleagues start to think to revert or to go to the clinical practice because, you know, the frontliners now, physicians and nurses, are the heroes, and they deserve this because they face a lot of threats dealing with cases of COVID-19, or even working day and night to help their colleagues, or to have a career shift to infection control because they are the leaders for the disaster management now. The other way around is just watching. Last one is to try to find a place under the sun. I know that a lot of our colleagues in quality, they have a major role in addressing this epidemic, but actually we will go through this slide to help them, or to help the others to bring them more on board with their colleagues. So this slide is very crucial for understanding and to play the main role of quality, not to play other roles. So it is like cascading, or it is representing the levels of responsibilities and starting from WHO, which is a global entity working on such epidemics. Their responsibility mainly is to address this epidemics by policies, recommendations, and they have a lot of very powerful resources that will help the organizations or hospitals to prepare themselves for the epidemic, including the checklist for hospital preparedness, and we'll talk about it in this presentation. Then in each country, we will have an entity, MOH, or Ministry of Health, or CDC, or other entities which will be responsible for addressing their national policies. And the term national policies is very important. So every country, they have their own context, even they have their own case definition, especially if they have focal areas with a lot of cases. So maybe the case definition would be different from country to country. So the policies referring patient to some of the referral hospitals, or they have military hospitals or other hospitals that are assigned to receive such cases. So these policies, contact numbers, portal, all of this will be very unique for each country. So our colleagues in every country should have a very robust communication methodology with them to understand, or to be able to get them the updated information, and to get relay this precious or very important information to their colleagues in the proper time. So the third level is the healthcare facilities, and we have different rules again. We have referral facilities, and we have non-referral facilities. Like this non-referral facilities maybe will have to deal with some cases, but if they they don't have the capacity, they can refer it to other facilities according to the national policy and procedures. The last and the most important one is healthcare professionals. They are the frontliners, and we have healthcare providers, nurses, physicians, and others. They are the frontliners. treat patients with COVID-19 and treat other patients that needs medical treatment. Non-healthcare providers, they play a major role in addressing the epidemic, in preparing the supplies, and also to have the logistics for the staff to try to facilitate their work. And actually, we will talk about the role of the quality professional in more details. I asked them yesterday if are you familiar with this framework or diagram. The majority said no, and this was like surprising for us, because this is a well-known NAHQ healthcare quality competency framework. So they had this and they like did a questionnaire for all healthcare workers to check their competencies in this framework. So to understand your level in each competency, and to seek more help if you have a weakness in one of these functions or competencies, and try to have more skills, more tools, and to play your role as quality professional in your hospital. Of course, the level of skills or the level of the competency will differ from your according to your role. If you are a quality director, will be different than quality officer or quality coordinator. But at the end, you need to address all of these competencies, including quality review and accountability, professional engagement, quality leadership and integration, performance improvement, population health, health data analytics, and patient safety. All of this are very important functions and competencies that quality staff should be aware of, and they should be aware of the tools needed to run such functions. Actually, the question here is where to focus all of this, or we need to focus on some points. We should agree that the main two functions that you need to focus on are the hospital readiness for COVID-19 and crisis management, and to ensure continuity of business. And I think all of hospital leaders are waiting for help from you and from other colleagues to address the two issues, COVID-19 as an epidemic, and to continue their business, although there is a lot of restrictions and a lot of limitations in supply and staffing and the influx of patients. Actually, this slide is like an innovation from our colleague, Dr. Muhammad Al-Fayoumi. He came up with these four functions as the main functions for quality professionals during this epidemic. We called it Q-SPEC. So it includes four main functions: standard compliance, performance improvement, emergency preparedness, and communication. Each one of us will talk about one of them. Dr. Islam Yusuf will talk about standard compliance, but because the video taping yesterday didn't cover this, I'll just give you some notes about the standard compliance, and then we will talk about emergency preparedness, Dr. Muhammad Al-Fayoumi, and communication, Dr. Ahmed Al-Sheikh, and performance improvement, Dr. Zakaria Abdul Hamid. And then after this, we will talk about crisis management. So starting by standard compliance, here the question is which standard we need to focus on. Shall we focus on the accreditation preparedness as the whole function, or shall we select some of these standards to focus on? How to ensure resilience of our organization towards such standards. So we came up with these ideas, actually was described yesterday by Dr. Islam, but as a note, so you need to facilitate, and the word facilitation is the key word of the whole presentation. You need to play the role of facilitation to your colleagues. You'll not be the leader for the emergency team or the disaster team, because actually there are a lot of technical issues that needs to be addressed, but your role is to facilitate and to ensure that their discussions, actions are monitored and is communicated in the proper way. So you need to facilitate the use of comprehensive the use and comprehension of any checklist your organization will approve or select to use. So you can your local hospital or facility may select the WHO checklist for hospital preparedness, or they have their own rules and regulations in their country, like standard from Sibahi, standard from Gahar, standards from other countries. So I think the most important things that you need to prioritize this and ensure that these standards are applied, and their utilization is properly done. So all stakeholders, including frontliners, will have this piece of information easily, without stress, as much as you can, because they have their own stress, and to ensure that these standards are implemented. Of course, infection control is a key word now. So infection control practices, including precautions, hand washing, all of this should be applied, and you need to ensure that the application is monitored. You can also ensure that the most priorities in the standard are implemented. So, for example, in ESA, in Saudi Arabia, you may focus also on ESRs. In Egypt, NASR, NASR, and in other countries accordingly, which we call it as essential requirements, because you want to not harm the patients in other way. So we will focus on infection control, but we shouldn't forget the other critical element that should be implemented to save patient lives and also to save your staff. Sharing in action plan, preparation and monitoring, and you need to use a lot of tools, especially if it will be like online tools, easy to be updated, easy to be tracked. And I believe Dr. Ahmed will talk about some of these tools in the communication slide. Fast tracking of the required documents and tools, and again, this is a key element here, that you need to have a unified document control or a unified document portal for your staff. Using hard copies will not be feasible for the time being, or if you have the hard copy, you need to have a very robust system in place to ensure that the latest one, or the updated version is available for the staff. So using like online portal will help a lot here. Ensuring the validity of data utilized and published, and again, this is will be done through this kind of online portal, online communication, and having only one source for information will help you and your staff to have the latest and valid data. I hope I covered this, but I think Dr. Islam was talking in a very broad manner yesterday, and I hope that I covered at least 80% of his topic. So emergency preparedness, Dr. Muhammad Fayoumi will talk about some of these elements, including facilitation of facilitating the creation and the timely update of emergency preparedness plans. Actually, if your hospital didn't start or didn't activate the emergency preparedness team or plan, actually this will be a very challenging thing, that you need to tell them that this is the only time that you need to have emergency preparedness plan or the team is activated. So if you don't have it, so you need to tell them we need to start convening this team to ensure that to ensure that our hospital is prepared, and the supplies staff are ready for any kind of changes, influx, or even having some of infectious patients. So to have this is very important. And you will play again
you just put the specific rule for each one and have the relative card with them, so they can comprehend and they can have a reminder for them how they can do this. So you come to the third step in emergency preparedness, which is testing and exhausting emergency plan. Exhausting emergency plan, this term I heard from one of the JCI surveyors, that you don't need only to test. You don't need only to make drills to make sure that the staff are ready. You need to exhaust this, not exhaust the staff, of course, but you need to exhaust the plan itself. You need to put or design drills that examine every and each aspects of your plan, and put scenarios that take the plan to the utmost measures to make sure that you are ready for this. And better to have problems during the drill than having problems in real emergency. And the last step is monitoring the application of post-drill collective plans. And this I see it many times. You will have drills, you have very nice corrective action plan, but the problem that these action plans are not implemented. Everybody after the drill, they have photos, they just shake hands with each other, and then everybody forgets about it. So it's important part as a quality professional to make sure that you are following up and monitoring these action plan and their implementation on real, to make sure that your emergency plan is ready, and if there is, la qadar Allah, any influx, any emergency, your hospital will be ready in this. The other and last thing that I will talk about in this is that you need to prioritize your resource utilization. You need to know before having any emergency how many equipments, how many staff, how many supplies that you have, and think when there is an influx, how you will deal with this. Examples for this, that you may need to look at your bed capacity and your bed occupancy. Look how many patients that you can transfer out of the hospital, how many patients can be transferred to less acuity. Also the use of masks and gloves, which area, if there is a shortage, which area will be a priority to have this in it. This is very important to be addressed in your emergency preparedness plan. Thank you.
Thank you, Mohammed. Actually, Dr. Mohammed, thank you for this. Just to highlight again, as all of us know, that we have a lot of documents in place. We have a lot of documents prepared for accreditation, including disaster management, internal disaster, and external disaster. And all of you know that during accreditation, the staff will be oriented. I think this is the time that you need to make this document applicable for your organization, ready to use. Staff will understand the rule in appropriate way. So again, emergency preparedness is not a term. It should be like a life. It should be like in the DNA now in your organization. Your role to facilitate, again, not to master it, not to be the leader. Facilitation is very important, and you have now the case. You have the case to show to the leadership that if we will not implement this in an appropriate way, actually we may face a lot of problems during any kind of influx. So this document, this checklist, should be available and appropriately distributed to all healthcare workers in the frontliners. So any additions from our colleagues? Okay, so the third element will be communication. Actually, I think it is not the first one. It should be the first one actually, because the communication here is the cornerstone of anything happening now. Communication about the definitions, communication about the influx, communication about management procedures. So I leave the floor for Dr. Ahmed Al-Sheikh just to show you us some of these items, and accordingly we can discuss it.
طيب السلام عليكم ورحمة الله وبركاته. Thank you so much for being with us till this point. I see, mashallah, we have 300 plus attendees. All of us are in the same boat. Remember that the whole world became a one single boat. All of us are fighting one enemy, and this enemy is invisible. I'd like to start from far away. I believe all of us heard about the movie Contagious, okay? And there was a subtitle to this movie that said, "Nothing spreads faster than fear." Nothing spreads faster than fear. This is from where you should start and focus your communication on. People are in fear. They are not in emergency, thanks to Dr. Fayumi for mentioning this, but they are in fear. And when we are in fear, we do not focus so much. We have lots of information that is piling up in our mind, and we need to sort this, prioritize this, and send this in place. Here you come. You are the warrior of quality that is fully loaded of information. How can you manage these teams and how you ensure harmony? If you remember that in the literature, we say that there are several types of communication and leadership, but I'd like to highlight one point, that in the dire emergency, you should be autocratic, just telling people what to do. But when the emergency is just like the one we are in right now, it is a pandemic. Remember, it is participative. You should make the best maximum use of the others. I mean others here on a vertical and horizontal level, and I am going to elaborate on this. From the vertical perspective, you should work as the link between the core team, the crisis team that you just heard about right now, and the departments. Make sure that there is a good communication channel of the hectic decisions that are being taken there in the core team and distributed properly to the departments. Make sure that everyone knows his or her responsibility. Make sure that there is a good follow-up system in place in order to follow these hectic decisions, updates from WHO, from the Ministry of Health, and so on. Horizontally, you should make sure that there is a good implementation of the communication styles. Make sure to have some dynamic teams. By the way, some hospitals in this pandemic, they started to forget about the ordinary structure that they have. Sometimes you need to trench some services for the fact of you do not have the luxury to work on the elective surgeries and so on. So you need to utilize properly the surplus capacity that you have in some good formulated teams that can help others to function best. Think of a team that can work on the resources. Think of a team that can work on the scientific and communicate the scientific knowledge to the staff. Think of a team that can help you to understand the staff, what they really think about. I'd like to highlight some points. Your role as a quality usually is to get the data and to disseminate it to the top management. It is still the same, but make sure every single data that you collect, you do not overwhelm the business. Again, focus on the business. Get the data, get as representative as possible. Lower your sample sizes. You may, by the way, slow down your regular business in order to communicate easily and to decrease distraction of the staff. Make sure that you have some good source of fact checkers in the hospital. I'd like to highlight that you should have a way. We usually measure the staff satisfaction survey, patient satisfaction survey. It's your time to intervene here and to take the feedback from the staff. How do they see all what we've been talking about the preparedness, the standards, and so on? How do they feel? Do they really feel safe in the hospital, yes or no? You should have answers. you should have some quantitative measure to say, okay, so my staff are really worried about X. I'm proud to share with you one of our experiences in my hospital during the previous Corona in 2014. We made a session that we named it Rumors About Corona, Rumors About MERS-CoV. These rumors, we collected it from the staff and we answered in a scientific way. Here at this moment, you are fighting the fear. You're making a good communication between your staff and your management, and this will reduce. So how can I make it? We are not allowed even to have 50 participants at the same time. Use the same tool that we're utilizing right now. Use Zoom, use Hangout, use whatsoever in order to get your staff in place. Collect feedback from your staff, collect the questions, collect fears, collect ideas. They're going to come up with marvelous ideas that will help you a lot in the coming part, which is related to the performance improvement. And make sure to collect frequently asked questions. For example, find some place like your website, or maybe a Telegram group, or maybe a WhatsApp group that you can solicit all this feedback and formulate it in a well-formulated, frequently asked questions, using the questions and answers. Make sure that you get the answers from the experts and make sure it is disseminated to the staff at the moment. There should be, as we said, utilize the electronic. When we say that in COVID, we are highly encouraged to utilize the technology, and let me highlight here that the technology is going to lead a lot. The Industry Revolution 4.0 is going to lead the whole world after this Corona pandemic, inshallah. People always jump to what we are doing right now. No. It's not only this technology. You have other technologies to utilize. You have the social media. Utilize social media wisely. You can even advise your staff to lower the roaming and wandering in your hospital. Use the telephone calls. Believe me, once you hear to your staff, they're going to give you a lot of marvelous ideas and a lot of unexpected fears. Let me share with you one example that I received from one of the staff, saying that, excuse me, sir, I am the one who's responsible, is from the patient relation. I'm the one who's responsible to put the patient ID on the first contact. Am I at risk to get this virus of COVID? This question needs to be answered. Should I wear a mask, the hustle of the world? Should I wear a N95 mask or the surgical mask? We're not saying that you as a quality are the subject matter expert who's going to answer, but at least make sure that you deliver the information on time to people. You are there, help to reduce this uncertainty with a very good communication. Once you ensure transparency between all levels of your hospital, inshallah, you're going to reach a very good consensus and a very good power in order to pass this may be a little bit long disaster, or let's say pandemic. One last advice here before I leave the mic to my colleagues. Always remember, KISS, keep it simple. Sometimes they say keep it simple and stupid. Sometimes to say it, keep it simple and short. Make sure every time that your communication is very simple and very short, or stupid as much as you like. Thank you so much, Dr. Mustafa.
Without stupid, Ahmed, I think it's keep it simple as much as you can. Okay. So this is a third action or third function that I think quality professionals should focus on. I think, again, as I mentioned, it is not a simple function, as Dr. Ahmed said. It is the core skill or core tool that will facilitate everything in the organization and will help a lot to give the confidence of the organization to the staff in the organization, and also to help them to address the epidemic or the infection in a proper way. So the fourth element that we will talk. تفضل دكتور محمد.
I just want to elaborate one subject related to, as you know, that during this COVID-19 period, that we need to orient and train the staff on frequent, as you said, that, for example, the case definition is changing every day. There is new information every day, and you need to orient and train your staff on these changes and on other topics like performance improvement and emergency preparedness. So some tools that you may use in communication, especially with current social distancing, that using the electronic forms. As Dr. Ahmed said, there is tools like Zoom that you can do it through it, but also think about utilizing some other platforms. There is many training platforms that allow you to just upload your PowerPoint presentations or even video presentations, and then you can design a competency assessment. So any staff, you can send the link to them and they can go through this a video presentation or a presentation, then do the assessments, and the platform can also generate a certificate for them directly through the platform. There are many of these. I just put an example in the presentation, like talentlms.com. You can just Google these platforms and you can find it very easily. Also, the other things that you can use animation. And there are also many platforms that allow you, even if you are not an animation maker, that you can use very nice tools to produce animations. And this can be also sent to the staff through WhatsApp to be put on screens in the whole hostel, so the staff can see this all the time. So this is another elaboration that I think that we need to add.
Like Ahmed, we are waiting for your animation. So we know that you already generated a very nice animation for some ESR. So we are waiting for this animation to be like publicized on the media, inshallah. So thank you, Dr. Muhammad. The fourth function, Dr. Zakaria Abdel Hamid will talk about it, is performance improvement. And the only message that I leave you before Dr. Zakaria will talk, I don't think so all of you, all the staff will be ready to talk about all the principles of performance improvement, or to ask them for a meeting to talk about Six Sigma project in away from this epidemic. So I think using tools in the proper way for the time being is the key word. How to do this, Dr. Zakaria will talk about it.
Assalamu alaikum. Finally, we reached to the main function of quality team in the hostel, which is monitoring the implementation of this plan. When the hostel CEO trusts the quality team, he will ask you about the ability of the hostel to deal with COVID-19, and he wants to give him a percentage. So you should simply do evaluation by the WHO readiness checklist. If you check this checklist, you will find items, and for each item you can, for ongoing item but not completed, you can give it 1. For completed item, you can give 2. Then you can calculate as a baseline now the situation of the hostel, and gives hostel a percentage of this. And you can check this again every week, 2 weeks, to see how the hostel is ready to deal with the COVID-19. After monitoring, of course, you can monitor every step in the plan. You can see the staff ability to tell you about his role in the plan. You can check the availability and functioning of suppliers. But also the main function of the quality to use the BI tools in the hostel. We can use the lean tool to fasten the logistics of this plan, to make the workflow of this plan smooth. We can reduce the cost. In this case, in COVID-19, we need to make contract with ICU physicians, with chest physicians, and we see in Italy a lot of deaths was due to they use orthopedics physician to deal with ICU patients. So we can, in this case, make education and training of all physicians in the hospital like how to use ventilators, and give them a privilege only in case of disaster to deal with these patients. We can also to reduce the use of resources and the limited availability of ventilators. We should develop guidelines to prioritize the use of ventilators in this case, like what happened in Italy now. Also, I think we all hospital should search about to minimize the period of checking positive cases. Now the MOH is the only place to who have the reagents of lab test for COVID-19. So I think all hospitals should have this test to decrease the time of from being a suspected case to be a confirmed case. Only this.
Okay, Dr. Dakre, jazakallah kull khair. Thank you. Actually, as a summary again, it's working smart now is very important. So to select the right indicator using the right data for the right time is very important. So again, it is your role here is to prioritize which indicator you will use to address the hot issues. These indicators can be updated according to their functions. So again, it is very important to give confidence to the leadership that we are ready or we have a problem in this area. It will give you clear understanding of what is happening on the ground using tools. And as we say always that the quality professional should have all tools in his bucket. So he knows exactly where and when to use a tool. And if the quality professional doesn't have this capacity, again, it's a very questionable. So it's again, the tools in your bucket, use it in the proper time to facilitate your work. So lean, we talk about lean a lot of time, lean and waste reduction, lean and organizing the work place, other methodologies, other tools. We talk about it a lot, but actually this is the time that these functions and these tools will be evident, and it will have the superiority to such surge in cases or surge in influx. So this is the fourth function. As a summary, we have.
Please.
Sorry.
I'll just add to some examples about lean use in this time. There are many examples that you can see in the picture. For example, this is from the BEC. What they are doing as visual aids, and we can do the same in the hospital to ensure the social distance, especially in a crowded area like ER, for example. If you have an congested ER or outpatient department, outpatient clinics, if still you are operating outpatients in your hospital. Also in the staff cafeteria, and this is also an area that may be forgotten all the time, that we may forget about our staff. You can use this visual aids in the cafeteria, so you make sure that the staff are not so close to each other while they are waiting to be served in the cafeteria. Also visual aids like arrows on the floor that can lead the patients with different colors from visual triage to, for example, to the ER, to the flu clinic, to isolation room. This is a very important part that can help the patients and improve the patient flow. So this is just some examples that we can use from Lean 5S and visual aids to help our staff and our patients in this era.
Thank you, Dr. Muhammad. Actually,
Dr. Mustafa, if you allow me to elaborate. So, and here it is very important to understand that the classic way of performance improvement to have the ease of having a team and working on a project for a very long time may not be feasible at that moment. So as Dr.
طب ممكن احمد ممكن تغير بس السلايد عشان انا حاسس ان احنا بنتكلم في حاجه وانت السلايد موجوده في حاجه يعني رجع السلايد اللي فات.
Okay, طيب okay. So it is easier here to follow what Dr. Fayumi was talking about, which is the lean, the visual aids, and so on. And I highly advise you to implement a simple collection of improvement ideas, such as the Kaizen. If you have a Kaizen in place, the Kaizen will help you a lot to collect this data and to work on it. Very simply, you're collecting the improvement ideas, and the team in a very simple two dimensions way, the urgency and the time, just put a very simple prioritization, select the most important or the highest priority right now, and work on it. Keep an eye on what you're working on right now, disseminate the results, and move on. Yes, this style of improvement does not seem that structured, but if you implement it in every single step of the processes, especially the key processes, the patient triage, the patient transfer to the ER, the patient transfer to the floor, to the CT, to the isolation room, and so on, it will help you a lot. And again, I'm elaborating on the previous point. Make sure to listen well to your team. They are the engine of the improvement. Dr. Mustafa.
Thank you, Dr. Ahmed. We talked about 4 functions, and we just want you to remember it. So we came up with this kind of tool. So you need to use the performance improvement, communication, and emergency preparedness, and of course standard compliance. So these are the main functions that we thought that they have the highest priority in your functions as a quality professional or a quality director. But we have added one of the functions that we know that most of us or most of the healthcare professionals has a problem in addressing this issue, which is the crisis management. So I leave the floor for Dr. Ahmed Al-Jamal to talk about crisis management. Actually, he has just implemented a lot of procedures in his workplace. So Dr. Ahmed.
Yes, thank you very much for this, Dr. Mustafa and everyone. So basically, I would like to talk about crisis management. And before talking about it, I want to share with everyone what my HR director told me just a few minutes ago. She just told me that this is the moment of glory for me and for all quality professionals. Why? Because especially for those who have quality and risk management and utilization management in their bucket, this is the moment where you can step in and say, these are the right things to do. These are the right things that I told you we need to do earlier, and this is the moment where we need to do it now. Saying this is very, very important to keep in mind that we have now what we call infodemic. There's not only a pandemic of coronavirus, there's an infodemic of information that flies all through the media, all through social media. Everyone now almost knows something about Corona. And this brings a lot of input, either valuable input or not so valuable input to the discussions that you might be having in your hospital. So please bear in mind while you are addressing the current crisis of coronavirus, that you have at least a basic understanding of who is going to communicate the real facts about Corona. Before going to the slide, the last point I want to highlight here is that the current hazard that we have right now is, as it is a pandemic, it is different from all other hazards that we have usually in our hazard vulnerability analysis. So we talk about a crawling hazard, a hazard that gives you time to prepare. It's not like a fire next door. It's not like an earthquake or a tsunami. It's a hazard that gives you time to prepare. That's why when you look at this slide, you can clearly see that crisis management has basically three parts. The pre-crisis, which our colleagues just talked about, the emergency preparedness, which is addressed in many, many standards, either business standards, healthcare standards, insurance standards, and post-crisis measures that are addressed by WHO, UNICEF, and all those regulatory organizations. But because now we are during the crisis, there are some things that we need to think of, in addition to the roles that my colleagues talked about. First, let's say that let's have a clear guideline on understanding what are the corona cases and how, thank you very much, and how our staff are dealing with it. We are not talking about prevention right now because it's happening, yet we can talk about prevention of spread of the infection amongst our staff. We are not talking about complete preparation at the moment, but what we can talk about is the partial preparation in our ERs, in our clinicals, among our clinical staff for the coming influx. For the crisis, so if you can flip the slide, please. Yeah. For any crisis, what a healthcare organization should be focusing on is first business continuity. How to continue doing our business and providing our care in a safe manner, without jeopardizing safety of staff or of the current patients. It's very, very important to do that, that we need to dissect the services that we provide. I know many hospitals at the moment that stopped doing elective surgeries. Many hospitals stopped doing ambulatory care services unless they are very, very, very critical, like chronic diseases, for instance, chronic disease clinics. You need to clearly dissect the services and find out what is the core business of your hospital. Is it an appendix hospital, a hospital that is based on appendix surgeries, or it's an open heart surgery hospital? And I'm not saying that appendix is less or more important. What I'm saying is you need to go into the nitty-gritty details of what is the core of your hospital. And the importance of this is that you can put these as your critical path, the path that you want to maintain all the time. And you need to make sure that all resources are directed to maintain that business line, beside the fact that you might be dealing with patients coming with corona. If one of your services are going to be referring patients with corona to other hospitals, then you really need to focus on that process and find out if there is any gap in that process and find out how you can close those gaps. And another point that is almost always forgotten, in big organizations, there are always that remote clinic somewhere in the suburbs providing some service. Do you really want to keep that service up and running during the coronavirus outbreak? Yes or no? This is a question for you to answer. Not only you need to bring it to the administration and find out, is this something that you want to continue providing? For any of the processes that you can identify as critical for your business, you need to look at this circle and put that process in the middle and think of, do you have enough human resources to support that process? Do you have enough logistics to support that process? Do you need extra supplies? Do you have the supplies available in the market, or you need to import them? How long would it take you to import those supplies and bring them in. Factors associated with places, as I said, geographically, but also things like Corona, where we know now that it comes in crowds. It's easily spreading in crowds. So you need to think of the places that you are going to provide the service, that particular service through. You need a place that is not crowded. You need a place that is well ventilated. Management factors, as you can see in the fourth circle. Management factors, how can you maintain quality of that critical service that you are providing in the tough time? Please bear in mind that hospitals are the frontline armies in front of these kind of crises. That's why you need to maintain a certain level of standards, a certain level of quality that you do not want to go below. Next slide, please. Yeah, I just thought of an example. So let's say that one of your critical processes is your call center. You are positioned in a place where there is a lot of calls coming in from people panicking from Corona. Every single person in your catchment area would call you or have access to your service from your phone number because they have, for instance, a cough, a small cough, or a small or little fever. You need to make sure that this call center is very well organized in a way that can provide answers for those questions. Meaning that looking at the circle that we just discussed in the previous slide, you need to think, are these people trained? Do they know what they should do? Do I have enough people running the service? Do they need any extra logistics? What would happen if the phone is cut? What would happen if the internet is down? Am I ready? Are they ready? You can think of things like, are they sitting all in one place, or can they work from home? Is their place or are their homes safe enough for them? Management, you can think of, can you maintain a certain level of quality? How can you make sure that, for instance, no abandoned calls? Maybe that one abandoned call was from a patient that had a very severe case. So you probably need to call them back and make sure that they are safe and they understand what to do in the difficult times. So that was a quick talk about the crisis management and how to identify critical processes and how to look at them. Thank you very much.
Thank you, Dr. Ahmed. I think we will have more sessions about some of these topics. One of the issues that we talked about the 4 main functions of quality, and then the crisis management. There are a lot of talk about it, a lot of tools. We talk about it today, but just to simplify what we need you to do, we had an example for you. One of the standards that are approved by your organization to use. Is it SPEC? Is it GAHAR? Is it WHO checklist? Whatever. So next slide, please. So let's take this hospital readiness for COVID-19 as a tool. So if you agree that this is your tool to be used in your organization, if you are in Egypt, in Saudi Arabia, in Emirates, on any location. So how to help your organization develop using this kind of checklist or tool to be prepared for COVID-19. So just as summary, it's like an example for you, and you can expand it using the 4 functions and the crisis management tools that we talk about. So next slide, please. So just a small example for you. If we will take the first one, which is the communication. So you need to think about how to help your organization in communication. So you need to, for example, you have to have a unified source of information. Is it MOH, Saudi CDC, GAHAR? And accordingly, you can develop a small online portal for for everybody to have the same information in the same time. You need to have timely update of documents. So is it feasible to use the hard documents for the time being? No. So you can use other methodology like the document control process, online document portals, whatever. So this is the way you can help them in communication. So robust and fast communication plan. So you need to have a robust communication plan. Communication plan means you need to have, as Dr. Ahmed said, and the other colleagues, you need to identify the source of information, who needs to know, when to know, and what is action need to do. This is a very important hierarchy that you need to use to implement such tools, and to use the quality tool that you already have experience using it in the proper way. So this is just an example for you. You have whole freedom. You have your own context in the organization or the country to use the framework that appeal to you and approved by your entity. And again, you can use each step and select the proper tool to help. And as a conclusion, if you don't mind, go back, next slide, Ahmed. As a conclusion, we have some messages here for you. You are so important facilitator in addressing this epidemic. Please don't play other rules. So don't go to do your own checklist, your own work. You need to be a facilitator for the team, especially the crisis team. Don't convey any message without verification. This is very important for you and for the team. Use your precious quality tools when it's really needed. And this is a time that we need this precious quality tools. Be optimistic and support your team. Learn from others and praise their efforts as much as we can. So this is to conclude our today's session. Sorry for the logistic issues in the beginning. It is my problem. It is not our team problem, actually, because I was the host. Thank you by name, Dr. Ahmed Al-Sheikh, Dr. Mohammed Al-Fayoumi, Dr. Ahmed Al-Gamal, Dr. Islam Abu Yusuf. All of you added a lot of value for this session, actually, and I hope we succeeded to give you some thoughts that can help you in addressing this issue in a proper way, not to waste the other team time, and to use robust tools to address the epidemic. Actually, we would like to thank all of you again for your attendance and your patience with us. And actually, if you have some questions, we will be delighted to answer you. So you can unmute all of our speakers, Dr. Ahmed, so we can answer some questions. One of the issues that already came up is the outbreak management. I think I'm not the perfect one to talk about outbreak management and the difference between emergency preparedness and outbreak management. But again, most of the policies that we review during our visits in accreditation talk about outbreak from internal outbreak point of view. So if you have 2 or 3 cases, how to report it, how to manage it in your hospital. So you need to expand this a lot to ensure that you address influx of patients. You already have the right case definition. You have the cohorting process. All of this in place. It's not just outbreak policy. It is a lot of policies, a lot of procedures, and I think using this checklist of WHO or other entities will help you a lot to prepare in a proper way. Do we have other questions? Ahmed, if you came up.
Dr. Mustafa, I recommend to as we, mashallah, we're right now 1 hour and a half. So, and I see lots of comments are in the private and the public. They're talking about we need more to talk more about the implementation and so on. So if you allow me, I can guide you to the form that we created specifically for this session. Please go there, post your thoughts, give us your feedback, and we may have a meeting later, and accordingly we can, if the team allow me to speak on behalf of them, we can have another session talking in details about a specific point that is that needs more elaboration from any of us, or even if the team allow me, if we need some expert to talk about it, we can invite them to join us and to elaborate on it with great pleasure. We're just trying to do our part to disseminate the knowledge. Another logistics point, some of you asked about the certificates. In fact, that this session was intended to disseminate the knowledge. It is not related to any institution, so we do not expect us to present you a certificate. More or less, we, again, sorry for the logistics, more or less we are disseminating the knowledge.
Okay, so we need to conclude. Ahmed, jazakallah kull khair. And I promise all of you that we will have very soon more precise lectures about the topics. But as Ahmed said, if you can send us your feedback, and if you have specific questions, in this session we didn't represent any organization. As Ahmed said, we were like representing ourselves, our experience. So Ahmed, we will send the same link of Google document. You can send us your feedback. جزاكم الله كل خير. We hope إن شاء الله كلنا إحنا نتمنى من الله سبحانه وتعالى إن this epidemic will go and go smoothly and without harm for any of you and for the country and for all countries actually. So thank you again, and we will post the recorded part of the presentation because it is not recorded totally. So we will try our best to post it soon. Thank you.